James and Schwartz, how may I help you? All right, feel better, Caroline. I'll pass it on. Excuse me, Dr. James?
Yes, what is it, Emily?
Caroline just called in sick, and she's the triage nurse today.
Okay, do me a favor. Gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Got it, right away.
Okay, perfect. I'll be there in 10.
Okay.
We're swamped today. It's flu season. We don't have time to stand around.
I know, but Dr. James called this huddle. He should be here any minute.
Good morning, everyone. I need to tell you that Carolyn called in sick and she was assigned to triage. So we have 3 providers here today, so we'll take turns covering for Carolyn. During your triage shift, you'll see your scheduled patients every 30 minutes instead of every 15. Any patient you can't see will be passed off to another provider during your triage shift. That way we can ensure that anyone who needs immediate care is appropriately seen. Any questions? No? Okay. Be sure, everyone, to explain to our patients that the wait may be a little longer today, but we're doing the best we can, all right? Thanks, everyone. Let's have a productive day. All right, sir. If you'll just have a seat right over there, we will get to you as soon as we can, all right? Thank you.
We're going to see you right away, so why don't you come on back in? It's that first door there on the right.
All right, sir. We'll get with you as soon as we can, okay? You can have a seat back in the waiting room for us. Thank you.
Excuse me, everyone. Can we have a quick debrief about today's events? Kelly, Sam, is that everyone? Yeah. All right, good. So, what do we think about how we handled our workflow today without a triage nurse?
I'll start. When I first heard the news this morning, I was a bit wary, but from the moment you called the huddle, I felt fine.
It was busy, and everyone was alert and acted as a unit. We seemed to communicate well and pulled it off just fine. I'd say it worked for us.
I'd agree with Dr. Schwartz. I mean, although this isn't something that I'd commit to on a daily basis, I think it would work as a last resort. I mean, we managed to come together as a team and support each other, and that led to a successful day.
I think it went well. Thanks for great leadership today, Dr. James. It helped us all ease into the situation confidently. Everyone appeared to be aware of what was happening and adjusted to make sure the patient's needs were met.
Don't forget Emily. She followed up with Dr. James immediately.
Thanks, Kelly. So if a triage nurse does call in sick again, should this be the plan of action?
That's a good question. From everything I've gathered today, this does seem to be a completely viable solution. So if everybody is comfortable with it, I think we should adopt this as the new default. Everybody on board?
I might just suggest that we have a provider or a triage nurse on call for this situation specifically. I feel that our patients shouldn't be passed around unless completely necessary.
Point taken, Myles. I'll look at the schedule, see what we can do about getting somebody on call. Anything else? All right. Well, excellent work today, folks. Let's close this place down and go home, all right?
All right.